Hello, hello. It's another Friday Aloha Live with Dr. Pete here in Waikiki, Honolulu, Oahu, Hawaii. So, a couple things going on today. One, got the Aloha Friday shirt on, got the Hawaii shirt on, but also because it is March Madness time. So, just for fun, let's have you drop into the chat who your team is that you're picking to who is your team, favorite team in the 64 field team, actually 68 now, and who do you think is going to win the championship? I really don't have any skin in the game, but my wife teaches at Grand Canyon University, who in Phoenix, Arizona, who play this evening or afternoon, and they're number 12 seed playing on number, I think, 5 seed, St. Mary's. So that's supposed to be on TV today. So Lopes up, let's go Antelopes, and see if Grand Canyon can make it to the second round. Very cool. All right, another thing we're going to talk about today, the most important thing is why we're here, is asking me the questions. And today the topic is neck, and more neck. So is it a common problem? People have neck pain? Because, you always hear in the news, people talk about low back pain, or studies come out, or my friend hurt his back or whatever. But actually, neck pain is far more prevalent than low back pain. At any given moment, 22% or more of people have neck pain. With back pain, it's about 130 million Americans per year. But think about, at any given moment, 22% of the population has neck pain, of which, on top of that, about 80 million Americans get 3 to 4 headaches a week. So when people say, yeah, I get a couple of headaches a week, and no, 0 is normal. But 80 million get 3 to 4 headaches a week. And 80% of those headaches come from this part of the neck, the cervical spine, the 5th and 6th vertebrae at the bottom. Itchy nose. So that's what people don't realize. They're looking for all these other common factors, and that's the small percentage. But 80% of all headaches actually come from the neck. So reason we're bringing up this topic today is that, I had a patient in on Monday. And, I've heard the term where we talk about tech neck, because people in front of the computer all day long and typing. But we have so many different professions that we treat. People come from all walks of life and all different types of jobs, that we wanted to get into some of the other types of necks. So there's tech neck. This gentleman had barista neck. So he was talking about how he's looking down and pouring and preparing and tearing and doing stuff on the counter all day long. So his issue is not a forward neck, it's being pulled down all day long. So we're going to talk about the mechanics of those. Then we also have mechanics, which is why I said that. And we've got them in awkward positions. They're in the hood, they're under the car, they're in the nose cone of an airplane. I've had airplane mechanics. So all these different awkward positions. Then we have electricians and painters, who they're not looking down, they're not looking forward, they're looking up and doing overhead work all the time. So, and then there's athletes, right? There's cycling, and then there's swimming, all involve the different positions of the neck. And that can give them all kinds of neck pain problems. Then there's people that sleep on their stomach, So again, look at all these different ranges of motion I've shown you. I've shown you up professions, down professions, turn to the side, turn to the other side, forward. We don't really see too many backward ones. But so here's what happens. So for every inch the head goes forward, we're putting more strain on the neck. And the neck's supposed to be that nice C-shaped curve, which we're actually not even born with. So when we are babies and we are born, we don't have any curve in our neck or our low back, because we've been like this for 9 months. So when babies learn to do the tummy time and the crawling, then they develop the curve in their neck. So what happens is then we do everything we can as humans to undo it. So what happens is that curve in the neck starts to change, or the head goes forward, and all that muscle strain, all that pulling over a long period of time, just like making a diamond. It's thousands of years of pressure on coal to make a diamond. Or teeth don't go crooked in one day. It takes a while to straighten them, or they go crooked. So same with the spine. For it to change shape, to become arthritic or overstretched or lose the curve, takes many, many years. So you really don't see kids with neck pain. You start to see that in teens, adults, 20s, and of course, any time after that in life. So what happens is when we have too many computers and we have too many screens and too many monitors, when the more we focus, just like in the car, you ever notice that you turn the music down and you're trying to find an address you can't find? So the same thing happens when you're concentrating, that head goes forward. And why? Because the computers aren't at the right height. And so, or you have too many of them, you're always turning them. So a little trick for there is not that you have to lean back and be against your chair, but actually by raising the monitor height so that it's about eye level. And so how do we do that? Well, there are risers, of course, you can buy now and electronic stuff. And remember the good old-fashioned way of putting a phone book or yellow pages under, or even an empty box. It should be an Amazon box somewhere in your house. You can put that underneath your monitor, and that raises it up so it's more of an eye level, and therefore the head goes straight versus trying to strain forward to it. Now some people say the computer's too far away. Well, of course, we're going to have to then jerry-rig, and that's an individual basis, jerry-rig how to get that monitor close to you. So if I bring this phone closer to me, it's a lot easier for me now to sit up straight. Oh, Stello, haha. When I go further away, the neck goes forward. Same with being a driver. If the seat isn't right and then the head has to go more forward when we're driving, it puts strain on that all day long. And so if we take a pillow, a cheap little towel, anything like that, and put it behind the seat, because it can mold to the shape of your neck and the seat, and it'll fill in the gaps between you and the seat or you and the chair so that it's actually supporting you more without trying to hold your head up or lean back or be in some awkward position. If we're talking about painters and electricians working overhead, then they're contracting backwards. So squeezing those shoulders after they've been up there for a while, or stretching the pecs out, will help take off some of that pressure. Similarly, if you just gently pull your neck over to the side and resist back against your neck, that will help relax the neck muscles. If you just stretch something that's been overstretched all day long, then by looking down and forward, then you're just going to perpetuate it. So you actually want to contract, or you want to go resist back against the way that it's been stretched. So that's why I'm not usually a big fan of this type of stretch or this type of stretch. It just perpetuates. So anything backwards, anything contracting. So does sleeping on your stomach cause a neck problem? Not exactly. It causes neck pain, or you can have a condition called torticollis, or turtleneck, when you wake up and you're stiff neck. But it's in the moment, so it's being in that position for extended period of time. That's going to cause stiffness in the neck. And then you go to then drive, and then you go to work, and then you're on social media in the evening, and then watching TV, and then sleeping. That's a lot of hours of the neck being outstretched in the wrong position. So of course it's going to break down over time. So of course there's going to be problems down the road. It doesn't have a chance to recover. And because my favorite saying is, the neck never takes a day off. The neck has to hold up the head 24/7, 365. So what do we expect? No wonder we have so many issues with neck pain and with headaches. Anyway, that's a good start. So also what I want you to do, besides dropping your favorite college team or your alma mater's name in the chat, let's also have you post what you do for a living so that we actually know, and it could even have a discussion at some point about the specificities of your profession and how that relates to problems you have. And it might not be the neck. It might be you stand all day long. It might be that you're in different, again, just different funky positions. I just came from the dentist this morning. I had my teeth cleaned. And by the way, my hair's growing back, finally. So I had my teeth cleaned. And again, the position that they're in, hunched over inside, hygienists especially, are bent over in awkward positions. I've nurses in the operating room, all that kind of stuff. So put in your profession so we get a feel for what it's like for you. That's very important when I treat patients, is I want to understand what they do so that I have empathy, but also an understanding for how they're dealing with that, how we can make changes. Here in Hawaii, because I'm right across pretty much a street from the Pearl Harbor Hickam base, joint base of Navy and Air Force, a couple years ago, go down on a sub, because I hear all these sub guys talking about their beds, how bad they are, their racks, and how they're standing in one position all day and going up and down ladders. So I try to put myself in literally everyone else's shoes so I have a better understanding of how I can treat you best and how we can find solutions for you. Anyway, that's Dr. Pete, done with Aloha Friday with Dr. Pete. Aloha. It's a beautiful sunny day now, a little bit of drizzle and cool, beautiful weather here in Waikiki. Have a blessed weekend. Remember, how old what do we say? How old you are is your business, and how old you feel is our business. Big announcements coming up real soon. Lots of amazing stuff happening in the IFC family and company. Kapolei, Salt Lake, Hawaii Kai. All right, God bless. See you next week. Mahalo.